Poor kids are going to have like a huge, one of those name tags on their desk. I'm like, these poor kids.
Absolutely. I get it. I just get very nervous about pronouncing other people's names sometimes.
Yeah, I do too. And I
Right.
usually
Oh,
get it wrong anyway, but
no.
yeah.
Apologies. I'm gonna try. I know I just asked you, but I might still get it wrong.
So, Sam, you'll give me share screen and then I'll be able to. Okay, perfect.
Absolutely. All right. Hello, everyone. Happy Friday. Welcome to today's Health Council Talks. We have a great presentation for you today. We'll be hearing from Hole in the Heart with Sandra Sanchez Barlander, and also Caitlin Kopp will be joining us today instead of Dr. Shannon. So I'll
Perfect.
get us kicked off with our land acknowledgements. The New Mexico Alliance of Health Councils gives sincere gratitude for the opportunity to live and work here on ancestral and unceded lands that have been cared for by our state's original peoples of the Apache Nations, Pueblos, and the Navajo Nation. We honor and respect the indigenous cultures, traditions, languages, and their rich contributions that continue to shape New Mexico. Together, we acknowledge the history and impact of genocide, dispossession, colonization, and ongoing systemic inequities on Indigenous communities. As a collective, we commit ourselves to working towards justice and reconciliation, dismantling inequitable systems, standing in solidarity with and respecting relationships with Indigenous peoples. The Alliance affirms Indigenous sovereignty, self-determination, and self-governance of New Mexico's tribes, nations, and pueblos. In offering this land acknowledgement, we encourage you all to reflect on your own relationships to the traditional lands and take concrete actions to dismantle systems of oppression where Indigenous peoples are empowered and celebrated. Just a quick reminder and highlight of Share New Mexico. So it's a whole statewide resource providing over 13,000 resources statewide. You can search by zip code, county, city, and a whole variety of community needs that you may be looking for. And then we have just a couple sessions left in our peer learning series. So next Wednesday and then 2 Wednesdays away, we'll be covering referral and navigation systems. So if you haven't registered yet, you can do so with this QR code and link. If you have and you can't find your link, just let me know and I'll send it over to you. All right, and without further ado, again, we have our presenters here today, so I will go ahead and turn it over to them to share all about Hole in the Heart, a congenital heart defect awareness.
Thank you. Hi, everybody. I am Sandra Sanchez Barlander, and I'm founder and president of Hole in the Heart. And I'll go in a little bit more detail about Hole in the Heart. Um, Hold on a minute. I'm having a hard time getting to my link. So let me get that going for you guys. Um, Hold on one more thing. Sorry, guys. Here we go. Okay. Can everyone see the presentation?
Looks
Yes?
great.
Yes.
Okay, perfect. Like I said before, I am Sandra Sanchez Barlander. I'm founder and president of Hole in the Heart. Today, we're going to be presenting Watch Their Hearts. It is an initiative aimed at supporting the timely diagnosis of congenital heart defects. This is a initiative that was created by Hole in the Heart and our Healthcare Advisory Board. So we're really proud of the work that we're doing with the timely detection of CHD. So I want to introduce you today to Caitlin Kopp. She is one of our healthcare education advisors. She's a pediatric ICU nurse at Presbyterian Healthcare Services. So she is in the trenches and she actually cares for pediatric CHD kids. She's on the faculty at UNM College of Nursing. She has a background in pediatric critical care and nursing education. And she has joined our board because she is a CHD family advocate. And the work she does is inspired by her niece's CHD diagnosis. So I'd like to introduce you to Caitlin.
Hi, thank you, Sandra. So yeah, I have been a nurse for a little over 8 years now, and I started in a pediatric cardiology unit. And I picked that unit because of my niece. She was diagnosed with a congenital heart defect towards the end of my nursing school, like the second to last semester. So I started to look into a little bit more, and that's kind of how I ended up also working with a lot of CHD patients and families. Um, We'll start off with some kind of like fast facts about congenital heart disease. It is the #1 newborn defect in the nation. 1 in 100 babies are born with a congenital heart defect. That's every 50 minutes a baby is born with this. And actually in New Mexico, our statistics are a little bit higher. It's about 500 or 500, 5 in 100 for the state of New Mexico for being born with a congenital heart defect. And just to highlight, because maybe y'all don't know what a congenital heart defect is. It can be any kind of structural issue with your heart. So thinking a normal heart is 4 chambers and 4 valves. Anything that structurally isn't born as like a normal structure of a heart is congenital heart defect. So that could be maybe a valve could be missing or missing a leaflet of the valve, which is just another structural thing. A ventricle could be missing, a chamber. There could be holes within the wall, which is kind of like more of a hole in the heart for depending on which chamber it's in. And it can be just even more complex, having multiple structural issues as well. Might move forward on the slides or no? Thanks, Sandra. So again, thinking like the spectrum of a congenital heart disease, we have our mild or more simplistic heart defects to our critical ones. So thinking hole in the heart is based off of Sandra's son had an ASD, so that's a hole in the heart between the top chambers of your heart. My niece has a hole in the heart on the wall between the bottom chambers of your heart. You can even have a hole in both of those areas, and that's what causes it to get more and more complex. And then even some of our more critical patients have just missing pieces of the structure of their heart. Like I mentioned, a missing ventricle, which is like the lower chamber. Sometimes they just don't have those. So these babies, if they're diagnosed prenatally, especially if they're more critical or complex defects, require immediate care, sometimes immediate surgeries within the first few weeks of life. And then our more mild or simplistic defects, if we know about them immediately, maybe we do surgery in their second, third year of life, or a procedure called a catheterization, where they don't have to have an open heart surgery. It'll go through a vein and artery in their thigh, and then we'll close the defects that way. That's what my niece had done, so that's a little bit more of a simpler fix. But in general, these hearts, there's no cure and there's no true fix to a congenital heart defect. These babies are cardiac patients for life. Perfect. So what we've found is the gap, especially in New Mexico, is being able to diagnose these defects prenatally is not always, not that it's not done, but maybe they don't have the resources. We're a very rural state. Appointments get missed, or maybe they just didn't have, we also don't have enough cardiology echo techs, the ones who do the heart echoes for the babies prenatally. There aren't a lot of those in our state as well. But generally speaking, how we identify these defects is prenatally with an ultrasound, or after birth, we cardiac congenital heart defect newborn screening, which has to do with these pulse oxes or this device we put on their hands and feet to see if there's an oxygen difference between the top and the bottom of the baby. That can kind of let us know a defect is probably detected. But in general, for the state of New Mexico, we just know there's a lack of awareness and education on this defect, which is a huge gap considering that our stats are even higher than the nation's. So, all right. So the real impact here is delayed diagnosis can also end up being more emergent situations, can cause long-term complications if not caught early, because it just means your heart's working harder for longer. But if we catch it earlier, we can at least be keeping an eye on it if it doesn't need a surgery, and giving certain medications to alleviate the stress on the heart. But again, if we can't catch it and it is a little bit more of a moderate to complex heart defect, it can lead to emergent situations. And increased healthcare burdens, and of course, mental health issues, not just for the child, but the parents. I mean, even knowing and being diagnosed prenatally that your child's going to have this defect and possible surgeries either immediately or later on in life is a lot to take on. I mean, just having a baby in general can be a lot to like mentally cope with sometimes. And then now you've added on this extra healthcare burden on top of it. So the parents do struggle. So our initiative that we started is called Watch Their Hearts. We go through the 6 warning signs that you could possibly see after birth. If the CHD wasn't caught prenatally or at the newborn screening before they left the hospital, these are important warning signs that you could possibly see later on after you left the hospital that might clue you in to ask your provider about it or even go to an ER if necessary. Okay, so our first 3, a big one that we see, especially in our newborns, is poor feeding or even tiring really easily while they're feeding. I like to think for babies, this is their exercise, is eating. So if they're not able to eat, one, they're not growing. And if they have a congenital heart disease, their heart's working harder during this exercise time period for them, because that's what feeding is for babies, is when they really get a good workout. And sometimes, so if they're not eating really well and they're tiring out, and that's not what you normally saw when you first started with your baby, and now you've seen this trend of not eating as well and starting to fall asleep more often, so then they're not getting maybe the 3 ounces that they usually take, this should be something you should bring up with your provider, that they can maybe look into deeper. The other warning sign we look at is the bluish color. This is what we see in the central area of the face, so your lips, nose, or fingertips. And it's not necessarily always blue. It depends on your skin tone. And we have a picture later that we can show you, but it can even have more of like a purplish gray depending on skin tone. But it's just a change in color in the central face area or in the fingertips and toes. That is a little bit more of an emergent, go to ER urgent care type of warning sign. But then our next one is fast and labored breathing. You might also notice this when they're eating. Maybe they're breathing faster or even having labor breathing. So increased work of breathing. Maybe you notice they're having pulls of their muscles in between their ribs, or you see pulls in their neck, or they're kind of flaring in their nasal area. That's your sign of labored breathing for babies. Our next one, extreme sleepiness or low activities. So this goes kind of with the feeding as well. So sometimes they get really tired feeding and are really sleepy, but also thinking now your baby's sleeping more than usual. Like that's generally what babies do, is eat and sleep, but they should kind of wake up when they're hungry. But if you're having to wake your baby up to feed it, that would be an extreme sleepiness. They're not maybe as active or playful if they're a little bit older, kind of getting closer to that 6 months, 12 months age. They're not doing their normal activities. These are warning signs that we want to bring up to your provider. Poor weight gain and failure to thrive is what we call it as a medical term. When we have babies or patients come in who are failure to thrive, which is meaning, I'm sure if any of you have kids, you've seen like the growth curve chart when you go in to do your checkups with your kids. If you're consistently below what the normal or average is, we consider that a poor weight gain or failure to thrive. So we will do typically some congenital heart defect workups as well as some other congenital workups to see maybe why this is that your child's not gaining weight. But if you notice before you even get to your clinic that maybe your child, baby, or older child is starting to lose weight, that could be a sign of a congenital heart defect as well. And then sweating during feeds or the low activity. So again, thinking that idea of for a baby, feeding is exercise, but it shouldn't be like the high level extreme exercise. They shouldn't be sweating to eat. That's telling you that their body's working harder to do just the basics of what the baby's supposed to be doing. All right. So your impact as professionals, you could be the first line of seeing these tiny little hearts and seeing these warning signs, or even educating your own family members who have newborns. So keeping these 6 warning signs in the back of your mind when you're having conversations with other families or with your own families with newborns will help kind of bridge that gap of not only education in the congenital heart area, but awareness to spread out, hopefully. What you can do is do these simple educations of these 6 warning signs that we've even given you, promote advocacy for them, encourage the parents that they do know their babies the best. Even as a nurse, we try really hard to listen to the parents because the moms and dads know what baseline or what normal is for their baby. We could see a baby come in and they look kind of normal to us, but it's not the normal that the parents are used to. And it's important that the parents know that they should be advocating for themselves, like they know their baby best. All right. Typical barriers we see in New Mexico, as I kind of alluded to in the beginning, is access to care. Our state is a majority rural area. And I keep seeing news articles of losing OBGYN clinics in our more corners of New Mexico. So it's a big challenge to even get prenatal screenings a lot of times, especially in our kind of the further out from central New Mexico you go. Insurance limitations. So what we found is, I know from working on our CV ICU, the cardiac ICU for pediatrics, even if we find a congenital heart disease, if it is kind of out of scope for our surgeon to do that surgery, a lot of times we have to send our families and patients outside of the state to get their surgeries done. And the insurance is usually, I mean, they do cover it, but it will kind of determine like which hospital they end up going to. So it's a strain on your insurance. And then of course the first time parent uncertainty, I think, especially talking with first time parents, you already feel uncertain when you have your newborn baby. And then knowing, at least educating with these first warning signs and giving them this empowerment that they know their baby, it is their baby, and they know when something's wrong, and just to speak up for themselves and their child. All right. So when to act. So trust yourself that you know your child, but there are multiple symptoms. When there's multiple symptoms present, that is an immediate care pediatric ER type emergency. I would say, especially with when we start to see the blue and the lips and the nose and fingertips, and it doesn't come back to normal quickly. It's like sometimes with a lot of activity, you can get that blue color and then it goes back. But if it's staying blue, that is an emergent presentation of a symptom, and multiple symptoms together need to go to urgent care or ER. if you're just seeing one sign and you've just been thinking about it a long time, it might be beneficial to call your primary care pediatrician and book that clinic time a little earlier than maybe you know you have one in 3 months. Let's see if you can get seen sooner. And this is the picture I was talking about. So that bluish tint color we're talking about, it really depends on the kind of tone of your skin. As you can see, it doesn't always look like a true blue color. Sometimes it has a purplish tint or even kind of a gray look to it. And so Sandra got this picture for us and it's actually really great. And then remembering feeding and growing concerns requires a prompt evaluation. But again, this kind of blue purple color is urgent. Go to an emergency room. All right. Is this you, Sandra?
It's me. Yeah.
Okay.
Okay, so I always like to do the medical side of our Watch Their Hearts and then kind of dig into why Hole in the Heart exists. We are a nonprofit, and here in New Mexico, we serve the whole state of New Mexico. We also belong to a couple of national coalitions and also international. So I wanted to go over our journey, our mission, and the Watch Their Hearts social media campaign. So this is actually a case study done for my son. He had lived with childhood chronic illness since birth. These are probably like 2/3 of the medical issues that affected our son, our oldest son. Before 5 years old, he had a lot of upper respiratory and inner ear infections. He had pneumonia and his lung collapsed, which caused developmental delays with speech therapy, occupational therapy. Before 10 years old, he started passing out and it looked like he was having seizure activity. The chronic ear infections in his ears led to surgery within his inner ear, and it caused partial deafness in his right ear due to excessive ear infections. Before 13 years old, he was having frequent vertigo and severe migraines. His migraines were so severe that he often would lose sight, and the passing out with seizure activity increased. So before 10, it was like maybe once a month. Before 13, it was 2 to 3 times a month. And then his freshman year of high school is really when his symptoms became more urgent and more dire of what we were dealing with him. He had constant vertigo. He wasn't able to walk. He would actually crawl from room to room. He had severe migraines, which often led to passing out. Passing out with seizure activities increased to 3 to 4 times a week. He lost 30 pounds overnight. He became bedridden. He was dealing with depression and anxiety. So I want to let you know that, he saw over 300 providers throughout the United States, not just in New Mexico. He was born in New Jersey. He saw providers in Dallas, and he also saw providers in Phoenix. So kind of with the warning signs that we presented, I like to show what those warning signs look like in our son. And if we would have had that education, we probably could have advocated him more in the for heart conditions. But his early years before 5, he was tiring easily. He was having feeding struggles. We had to change him to a special a special um, formula where because he was allergic to the standard formula and he was having a hard time breaking down proteins. He had frequent respiratory and ear infections. He had severe asthma, allergies, and lung issues. Um, so, um, basically, this is why we founded Hole in the Heart. Me, my husband, and our two sons. So what came to pass with our oldest son, his name is Kai, some parents found us one day on our youngest son's school and said, your journey sounds a lot like what we went through with our son. They recommended us seeing a congenital cardiologist at pediatrics and said, go and see Dr. Davenport. Do not see any other cardiologist, see this one. And within 20 minutes, she diagnosed him with a hole in his heart. Finding the right doctor and the right specialist at the right time is really what saved our son's life. He ended up having an atrial septal defect, which is a hole in the heart of the upper chambers. He had a 10 millimeter hole in his heart, which is about the size of a nickel. That was the cause of all his lung issues, its upper respiratory infections in his ears, the reason why he was passing out. And now that we look back, we know that he wasn't having seizure activity, but his body was shaking in helping the oxygen to get back up to his brain. So our oldest son's late CHD diagnosis had a big impact, not only on his life, but also our family's life. All of us were impacted by this journey. Our youngest son was actually became the big brother in this situation. He became, he had a lot of anxiety. He became his protector. He worried about him constantly. And our youngest son is still healing from this. He's still dealing with anxiety because when you have a traumatic event in your life, even though things may have been rectified and Kai was diagnosed and we knew what the diagnosis was, trauma stays in your body. It's not like a light switch where you can turn it off. So for us, as far as impact for our family, Kai dealt with depression and anxiety after the diagnosis. He took some time off after he graduated from high school and asked us if he could take a couple of years to what he came to us and said was just to be. And when we look back now, we realize he only knew how to survive being sick all the time. And then after his heart surgery, he had to relearn and experience for the first time of what it felt to be healthy. And it took him a minute for him to start living in this healthy body and to actually trust being healthy again. So, he would experience and kind of not trust that he wasn't going to pass out anymore. So these are the impact of having a late diagnosis. It does reshape the entire family. So with that being said, we took about a year after his heart surgery, and of course, all of us were on a different road of healing from that experience. And as we started to share Kai's story with other people in our community and people who knew him, a lot of them started speaking out of having their own family members that have congenital heart defects. And as we did research on congenital heart defects, because we had never heard that medical term, and most families and mom and dads don't hear that term until their own child is diagnosed with a congenital heart defect. We realized there was a lack of not only knowledge, but education, and also a representation here in New Mexico. And me and my husband kind of looked at each other, and we thought, someone has to do this. And we just did not want another New Mexico family to go through what we did. So based off of our own lived experience with childhood chronic illness, we decided to create Hole in the Heart, and our mission was to raise awareness of CHDs. So just to talk to everyone and anyone about congenital heart defects facts that Caitlin shared earlier. We also are building partnerships to improve the timely detection of CHDs, and we see you as our partner in doing this. And also to promote best practices for the timely detection and care of CHDs. So this is why we created Watch Their Hearts. And it is, like I said, a unique timely detection tool that we're hoping to spread within different partnerships and get to statewide New Mexico families so they can have the information if they see these warning signs to always talk to their baby's doctor and to share every small detail that they see that is happening with their newborn. So what we're doing with Watch Their Hearts campaign, we're using reels, print, and outreach to share this campaign with communities and statewide efforts. So here are some of the ways that you can see these reels. You can go to our YouTube channel, you can go to our website. We're posting them on Facebook, Instagram, on TikTok, and our LinkedIn. We really tried to focus on a target audience of 16 through 26-year-old parents. And so we're really focusing on Instagram and TikTok because we feel like that's where young moms go and get their information. We also early on wanted to partner with initiatives and other avenues of the Department of Health, New Mexico Health, and the Department of Health Newborn Screening Program. And also we have partnered with the Brindle Foundation. They have provided funding for this initiative and saw real value in Watch Their Hearts. I'm going to go ahead and stop our presentation. And then I'm going to show you, let me go and get the video load up. Sorry about that. Okay. Okay. Can everybody see the black screen that says, yes. Okay, great. Okay. So I'm going to show you, we actually produced reels. So we had a advertising firm, their name is New Mexico. They're called MCO Advertising. They were located in Las Cruces. And they created these reels for us. So there's 6 reels, 1 for each warning sign. And then there's a PSA that showcases all 6 warning signs. So what I'm going to show you today is the PSA that was created. But if you go onto our website or any of our social media platforms, you will see that each week we're going to be showing and highlighting each warning sign. So the first reel dropped on Mother's Day, and every week a new one will be showcased. But I really wanted to show you this PSA because it kind of elaborates on all 6 reels into one 30-minute PSA. We were very strategic in the moms that we asked to be in our reels. They are minority moms because we wanted to be very strategic in New Mexico moms seeing themselves in these reels. So I'm going to go ahead and show that to you now.
Congenital heart conditions can show up early in baby years, often through small signs or little changes. These may include problems with eating, poor weight gain, taking extra effort to breathe, more than usual sleep, rapid breathing, sweating during feeding times, or a bluish or gray tint around the lips, face, or fingertips. These signs should always be discussed with baby's doctor. Seeing baby's doctor early can help find any problems and make sure baby is receiving the care they need. This message is brought to you by Hole in the Heart with funding support from the New Mexico Department of Health and the Brindle Foundation.
And then I'm also going to show you the first reel that we dropped on Mother's Day. Hold on, let me get back to you.
Oye, mamá,
Oh,
sé que
sorry.
nuestros bebés duermen.
Just to let you know, so that you saw, we did it in English and Spanish to get a bigger target audience.
Hey, Mom, I know the babies sleep a lot, like a whole bunch. But if I seem extra sleepy or it's hard to wake me up for feeds or playtime, that might be something to keep an eye on. It might be a sign of a bigger issue, but my doctor can check to be sure.
You know your baby best. Learn the signs of congenital heart conditions at holeintheheartasd.org. This message is brought to you by Hole in the Heart with funding support from the New Mexico Department of Health and the Brindle Foundation.
Hey, Mom, I know babies
Sorry.
sleep a lot,
Sorry
like
about that.
a whole bunch. But if I seem extra
Okay. So, we would love your feedback on these videos. And if you have any questions about the 6 warning signs or this initiative, we'd love to, talk more about how we can get this information out to your communities. And if there's an opportunity to present the same presentation in your community, we're always willing to do that. Is there any questions?
Not sure if, you would have the answer to this, but do you know, is there any, correlation or causation between why it seems to be it's a little bit higher in New Mexico versus other places in the US?
Well, let me tell you where we got that statistic. The New Mexico Department of Health our New Mexico Department of Health newborn screening program created a birth defect surveillance department, and they actually came out with a birth defect surveillance report, and it was they tracked and all birth defects, not just congenital heart defects. So we're using that was reported on that report. It was from 2014 to 2024. And at the end of the report, because we were also curious, we were like, that would be wonderful information to share with parents of why, to help, get that statistic down and help with awareness and education. And they actually said that they don't have the manpower to figure out why this is happening. But, our healthcare advisory board have talked about it. We've actually met about it and discussed. We think it may be because of the high minority population we have here in New Mexico compared to other areas in the nation. Hispanics, Native Americans, and Blacks tend to have higher tendencies for heart disease, which can go hand in hand with congenital heart defects. So we're thinking it may be that. One of our healthcare advisors, Kelsey, actually she's a doctor now, she just graduated, Dr. Kelsey Leibenhut, is actually going to be partnering with the New Mexico Department of Health newborn screening to offer her services in figuring out why. So that's a next project, and it may take a while for us to figure that out and for Kelsey to figure that out. But you know, she did her dissertation on this report, and she wants to help New Mexican families, and she wants to figure it out. We're gonna help her and help support her in that initiative. But yeah, that's a great question. We are also curious about that.
Good to hear that there are some next steps to try to
Yes.
figure this out for sure.
Yes. And we're actually going to be, myself, my husband, and Caitlin are headed to the National CHD Advocacy Conference next week. And we're going to be sharing with them about it's higher here. And could it be higher nationally too? Or is this just a New Mexico thing? So we're going to be questioning others in the United States about, you know, is this something that's happening in your state, or is this just a New Mexico thing? We're very curious as well.
You have a comment in the chat. Thank you for sharing your story. And then does the data also include tribal and IHS data?
Caitlin can answer this part.
Yes. So we were trying to actually figure that. We were just at the New Mexico Health Symposium where a lot of the New Mexico Department of Health is. As far as we know, the tribal IHS data is not part of the New Mexico data, and I think that's because technically as the reservations, you are your own states, you're not part, so you're like separate from New Mexico, but we are trying to figure out how we can get that data and include it with it, because it's possible that maybe our numbers might even be higher. But no, from the data we gave you, the tribal data is not a part of that.
And we're also wondering, and maybe you all can answer this for us and give us some answers on that. IHS and also the VA are not included in this report, and we're thinking it's because it's a federally funded department. But we are going to be talking with New Mexico Department of Health when we return from our conference next week about how can we include that information into this report into the next 10 years, because that doesn't give us a great representation of our state. And, you know, we want to always, our advocacy isn't just for one subset of race. We want to represent everybody, and we want a great representation of everyone in our state. That's the only way we're going to be effective in our cause and in our advocacy work, is if everyone is included and every New Mexico family are represented.
Absolutely. Joyce, I see you have your hand up.
So I want to say hello. So I'm Joyce Runyon from Coy County, and I actually met you at the New Mexico Health Symposium this week. So it's nice to see you here on our health talks. It sounds like you can have a newborn screening that gets a screening and everything looks okay, but then it can actually manifest itself later. So are these screenings continuing like at well baby checkups? Is this just like a one time we do it at the hospital before you leave and then you have to be just paying attention? Or how does that work?
That's a great question. So yes, a lot of times you pass that newborn screening before you leave the hospital, and it's possible that you maybe have more of a simple defect that is asymptomatic. It's not showing symptoms, and maybe you show symptoms later on in life. But yes, when you go to your pediatric visits, there are supposed to be checkups where they're still checking your pulse ox readings, so your oxygen level saturations and your blood pressures, because sometimes your blood pressure can be a cue that maybe if you're hypertensive, that something's going on, especially for a kid. Like generally, they're not supposed to be hypertensive before they're like 18.
Yeah.
So those are generally ways that we can kind of pick up on it, but also those 6 warning signs is what helps the parents advocate for themselves if they notice any of those things going on to kind of clue in the provider to maybe dive a little deeper and do some more screening.
And then I'm also curious about like how many families fall into like Sandra's category where their children are much older and this is actually diagnosed first off, that they catch what it is and figure that out and have treatment for that. Are there a lot of families in that demographic as well?
I don't know the exact numbers for that, but just personally from working with a lot of cardiac pediatric patients, I have seen, gosh, over 8 years, maybe like 15 patients that were a little bit older when we diagnosed them with heart issues, or probably closer to 20 actually. And that's like from school age and teenagers, where they clearly had some kind of structural or even a arrhythmia type situation that we didn't catch when they were younger, and then um, they found later. Like, and it's just because some of those symptoms that we've described to you can also be symptoms for other issues going on. And
Mhm.
that's providers get really lost and confused in the weeds of what exactly is causing those symptoms.
Well, and it would be hard to think it's a defective heart because it's a child who should have a healthy heart. And so I can see how that's kind of like, no, we're not gonna, let's check these other boxes first. So that's just really very interesting. Thank you for your presentation.
And also, Joyce, to continue with your question, answering that, um, there's a lack of CHD awareness and education among providers also. CHD really became, a lot of organizations like ours and nationally, that's what we're trying to do. We're trying to put CHD in the forefront. Um, More children will die from a CHD than from all childhood cancers combined. Um, Yet CHD is not funded or researched as much as childhood cancer, or there's not a lot of focus on it. And organizations like ours is putting that in the forefront. Knowing that it's the number one newborn defect, I don't even think a lot of moms know that. Like I said, we had never even heard the medical term congenital heart defect until our son was diagnosed. And that's what happens with most parents that are diagnosed. They didn't even know a congenital heart defect existed. So that's why awareness and education is important, and getting the word out of CHD is the number one newborn defect. It affects 1 in 100 children. Newborns here in New Mexico, it's slightly higher. So these are the things we're working on. But it takes everybody's help. And that's why we're here today, to create additional partnerships and additional channels to help us get this information out. And hopefully, if you see an opportunity for us to present, we would love to do that. And also, I'm creating promotional items, magnets for parents, refrigerators, and just like little mini brochures for healthcare providers, home health aides, or home visiting groups that go out and see families. And also creating little, like a little postcard to give to families that are expecting a newborn parents.
Those are really great ideas. So I think you're on the right track with all of this.
Thank you. I appreciate it.
Great. Does anybody else have anything they would like to ask or put out there? Okay. Well, on Monday, I will send all this information out to, oh, Geraldine, go for it.
No, I was just going to thank Sandra and Caitlin for your presentation. We in our family have also a personal story with CHD, and our baby being born with a hole in his heart. Not sure what the medical term is for that, but he was with us for a very short time of a year. But I think the hardest part was the mental support for my brother and his wife. And I think still to this day, I don't think they've even truly, I know that like grieving never ends, but like recovered or fully understood like the why of all of this. So if there's any way the Alliance can bring awareness, we can connect you all with more tribal health councils or just county health council. Like we have a whole network across the state. I think this would be great. I love the point about like the lack of awareness in education, because that's definitely something I see. Just my personal opinion from being from the Navajo Nation. You don't see it a lot until it happens to like a family member. So, but thank you all so much for your presentation. I enjoyed it. Thank you.
Geraldine, I want you to know I'm very sorry for the loss in your family. But when we go out and talk, we find that there's family members that come out and say a lot of what happened to you within your family. And I don't, I'm sure it feels very lonely knowing you went through that, but there's other parents and family members that have gone through what you're going through. And that's why we exist, Hole in the Heart exists. So that other parents and other families don't feel so alone in this journey, because, CHD is for the rest of your life. There is no cure. So it's for the rest of my life. It's for the rest of both my son's life and my husband's life. And, your story is important. And if you are brave enough and, would like to get involved with Hole in the Heart, we would love to share your story. I think lived experiences is the way that policy changes and is really powerful. Because, as we talk more about CHD, we hear about other family members, their lived experience, and they're different from ours. We're very lucky that our son survived this, but I also know that if Dr. Davenport wasn't there in that year that she was here in New Mexico, our son probably wouldn't be here, or he would still be struggling. So these things, this is real and it's important. And how do we get the word out? And those are things that our board is working on. I do want to brag on our healthcare advisory board. They're pretty amazing. And 80% of our board are CHD advocates. So not only do they work in the medical field, they also have personal stories of their own with CHD, which makes it pretty powerful in what we're doing. We always like I said, we're being sincere where we want representation of our state in every way. We are a high minority population, and we want to make sure that everybody is represented in our state, and that has, the best CHD care that we can get in our state. We don't have to send, families out of state. We're working on that. There's so many layers with CHD, but we want to be a strong advocate and a strong, we want you to see us as somebody that will help. And please contact us. I'm being sincere in saying we will present, we'll send material out to you. We're happy to work with you.
I actually just dropped a link in our chat because for the advocacy day that we're going to in DC, they are having this map where if you hit that link and you want to share your story, or if your brother and sister-in-law want to share their story on this website, it'll help draw attention to our state because it like pinpoints more of the CHD stories when we go.
And Geraldine, I also want to let you know that one of our goals by the end of this year is to go and, seek funding for mental health and CHD. It's something that is on our to-do list, where we want to create some parent support groups, and also more information on, mental healthness, self-care, grieving, and take a bigger look for CHD and mental health. There was a report that came out from the American Heart Association that did a study on mental health and CHD. For CHD patients in adolescents, it was 25 to 30% will have depression and anxiety. For parents that has a child with CHD, it's 50% to 70% will have PTSD, anxiety, or depression. So we're really trying to focus our attention on taking care of our parents that are caring for a CHD kid, because the heart is a serious organ, and it comes with some seriousness when your child is diagnosed with the CHD. It feels very heavy, and I will say I don't panic as much when I get a call from my son, but I wait to hear his voice on the other end to make sure he's not feeling sick, or or if it's a less serious call. So I'm working on that. But this is very real. It affects every family member, as Caitlin probably can attest to. She worries about her niece. Probably even more so because she's in the medical field, so she knows a lot more of, she probably leads with her medical mind first versus, personal, but it's, this is a real thing, and we're trying to change the way CHD is seen in New Mexico.
Well, thank you all so much for the work that you do. I mean, truly, I think Val always says this, but hard work. I mean, and yeah, I know my brother, he's open about it. He's struggled with like behavioral health, substance use, things of that sort. He's fallen into a deep depression. So it's almost like we as a family didn't really know how to support him and his wife. So thankful for associations like yours and organizations. So yeah, if there's any way we probably could connect on the personal end, I'd love to get my brother and his family connected to you all.
I would love that. We'd love to hear his story. We can have them on for one of our board meetings, and come up with some resources to support them. We would love that, Geraldine. Please reach out to us, okay?
Will do. Thank you.
You're welcome.
And I put your email in the chat in case anybody here wants to reach out to you as well. It sounds like you're making really great materials and products, so feel free to send those over and I'll share them out wherever I can. If anybody here has any questions or wants to follow up, again, feel free to reach out to Sandra. You can reach out to me and I can connect you as well. And all of this will be shared out early next week also. But thank you so much for joining us, for presenting today on this really important topic, and for all the work that you're doing here.
Thank you for this opportunity. We really appreciate it. And thank you for
Absolutely.
being a partner
Yes,
with
absolutely.
Hole in the Heart. Thank you.
Yeah, let us know if there's anything we can do with you for sure.
I will.
Have
Thanks,
a great
Sam.
weekend. Thank
Okay.
you.
Bye, everybody.
Bye.